Hello, I'm Austin Heyman. Welcome to Seniors Today, a monthly program produced by the Commission on Aging and devoted entirely to issues and interests of Montgomery County seniors. This month we will talk about how the JCA Heyman Interages Center programs bring generations together and how the Jewish Social Service Agency helps seniors stay independent. But first, millions of Americans are caring for a parent, spouse, or other loved one, helping them to live independently at home. And for many, family caregiving is more than help with household chores or providing transportation. It includes complex care responsibilities that were once provided by medical professionals. This month we talk with Tammy Bresnahan, Associate Director of the Maryland AARP, and Vanessa Briggs, Vice President for Community Health at Holy Cross Hospital, about the Caregiver, Advise, Record, Enable, or the CARE Act. Well, welcome to Seniors Today.
Good morning, Austin. Thank you.
So, Tammy, AARP has been at the forefront of advocating for this new act. Tell us a little bit about it.
Well, it's just exactly what you said, the CARE Act. It's an acronym for Caregiver, Advise, Record, and Enable, and it does three things. It allows the caregiver to be designated in the hospital record. It requires the hospital to notify the caregiver if there's any changes in the patient, like they're being transferred to another facility or they're being discharged. And the third is a little bit of education on how to take care of that patient once they get home. You know, today, like you said, more and more caregivers are being asked to do more complex health-related caregiving.
So how are hospitals responding to this?
You know, that's a really great question, and I can certainly speak on behalf of Holy Cross Health. We've actually been implementing, I think, parts of this act outside of the tracking mechanism because we recognize the importance of that continuum of care when patients are in the hospital and making sure that there's a smooth transition, incorporating caregiver education and resources into the discharge planning for hospitals.
So exactly what's supposed to happen?
So I think from hospitals' perspective, it really is about how can we equip caregivers with the education and resources that they need to ensure that they're taking care of their loved ones upon discharge from the hospital. And so for instance, within Holy Cross, we have a caregiver resource. And as of last year, we've seen about 3,735 people actually visit our caregiver resource center. Our resource center is equipped with a library, a telephone tip line, as well as caregiver support groups that family members and loved ones are able to access, because it really is about how can you equip that caregiver with the right tools, education, and information so that they can take care of their loved ones.
So you see this happening around the state?
Yes, we're working very closely with the Maryland Hospital Association and other hospitals across the state, and they have it in their brochure. We're actually giving out cards that people know exactly what their rights are once their loved one is admitted into the hospital. So you can go to our website, aarp.org, CARE Act, Maryland CARE Act, and get a card, and you can keep it in your wallet, and you can ask for these particular things when your loved one is admitted.
So give us some example maybe of what might happen for a specific person. Do you have, some?
I think sort of an example could be in which a loved one is admitted into the hospital, and within Holy Cross, we do try to incorporate the caregiver into the care planning process prior to that patient being discharged, so that the instructions that the patient is given, we're also able to share that instruction with consent from the patient to be able to talk to that caregiver so that they're able to help render the care once they're discharged. And I do think the Act will really assist a lot of other hospitals, in addition to Holy Cross, in making sure that we're able to track how well we're doing with the Act, because we recognize that caregiver support can also help reduce readmission rates within hospitals. And so I think that this Act will be very significant, enabling hospitals to do just that.
So supposing I'm a caregiver and the patient comes home and I have a problem, can I call somebody or? Is there a resource that
Depending on the condition that the patient is discharged, within Holy Cross there are many avenues in which they can seek additional care. If we're able to equip their caregiver with additional information, we always provide them with phone numbers that they can call their physician. If it's a matter of making sure that we need to connect that patient to a medical home, for instance, within a health center, we also provide them with health center numbers where they can speak to physicians. And we're also able to provide them with other types of educational programs and services that they may need, be it hospice or if it's rehab services. So depending on the condition of the patient when they're discharged, we ensure that we provide them with the appropriate contact information.
So do you have a website or a phone number that you want to?
We do. I mean, I think if you go to holycrosshealth.org, you'll be able to find a lot of information within the community health services portfolio, where a lot of the programs that caregivers can benefit from will list programs and services.
And do I understand that you have some health centers around the?
We do. We like to call our health centers sort of the safety net health centers because they service predominantly uninsured and underinsured individuals. And we also like to make sure that we're talking to caregivers because oftentimes the patients that are seen in our health centers, English may not be their first language. So we do encourage family members to come along with their patients. And so these health centers provide primary care, they provide post-emergency room visits, as well as they provide hospital visits, post-hospital visits as well.
So, Tammy, tell us also about, I mean, you're involved with other issues in what are AARP's priorities for the next year in Annapolis and generally with advocacy in Maryland?
So we'll be working with a coalition, which includes the Maryland Attorney General and others, that will require drug companies, prescription drug companies, to outline their cost. We will be working on affordable and reliable utilities. That's a mainstay where the utility companies don't charge residents before their lights come on with exceedingly high surcharges. We will be making sure that on the federal level that Social Security is solvent for generations to come, and we'll be mindful of what's happening with Medicare as well.
A big plate for you.
Mm-hmm.
That's right.
Well, thanks for coming in for both of you.
Thank you for having us.
When we return, we'll talk about JCA Interages, so please stay with us. We'll be right back.
Looking for a way to get around downtown Silver Spring? Hop on the Route 28 Van Go Free Circulator. The Route 28 Van Go Free Circulator provides rides Monday through Thursday from 7 a.m. to midnight and Friday through Saturday from 7 a.m. to 2 a.m. Fast, convenient, and free. There's no better way to get around downtown. To find out more information about the Route 28 Van Go Free Circulator, including route information, visit us online or dial 311.
In Montgomery County, we have a goal to reduce waste and recycle 70% of all waste by 2020. By recycling and reducing waste, we save natural resources and make our community even better. So recycle at home, work, school, everywhere, and keep recycling going. For more information, call the Montgomery County, Maryland Division of Solid Waste Services at 311 or visit montgomerycountymd.gov/recycling.
Keep it going.
Recycle more now.
Did you know there are more than 10,000 county government phone numbers? But there's only one number you need to remember for non-emergency calls, 311. MC311 is Montgomery County government's online telephone information system. Need information? Have a problem or complaint? Trying to locate a county government facility? Call 311. The call center is open Monday through Friday, 7 a.m. to 7 p.m. The website is available 24 hours a day, 7 days a week.
Welcome back to Seniors Today. The JCA Heyman Interages Center intergenerational programs have brought children and isolated older adults together for 30 years. Hundreds of dedicated and caring older adult volunteers, who are the heart of Interages, have made a significant difference in the lives of children. Joining me to talk about this are Leah Bradley, Assistant Director of JCA Interages, and Marcy Frosch, a volunteer. Well, welcome to Seniors Today.
Thank you.
Thank you.
I guess I should tell our viewers, in the interest of disclosure, that I was the founder of Interages.
Yes.
But tell us, what is the mission of Interages?
Sure. The mission of JCA Heyman Interages Center is to intentionally and meaningfully bring together the generations, offer opportunities for both older and younger residents of Montgomery County to come together, learn from each other, and benefit from their time spent together.
And you have an exciting new program.
We do.
Which is called REAL?
Correct. It stands for Reading and Educating to Advance Lives. We call it REAL. And it is a partnership with Montgomery County Department of Health and Human Services, the Children, Youth, and Family Services Division, Department of Public Health, and Montgomery County Public Libraries.
And its purpose?
The purpose is to read to young children in the DHHS Service Center lobbies, to offer an opportunity for children when they're coming with their families and caregivers to learn a little bit, have fun with some volunteers, do some early literacy activities, arts and crafts. So really to have a warm, caring experience while they're in the lobbies of these centers.
So, Marcy, you are one of these volunteers. What happens?
I am indeed. Well, first I would like to say what a privilege it is to be part of this pilot project. It's very exciting. It's extremely well organized. I give you a lot of credit for setting it up well through JCA. So we feel as if, I will do it from the perspective of a volunteer who's coming in, what it might be like to be involved. We have an opportunity to be with the children, roughly 2-hour segments. I'm volunteering once a week, which isn't a lot of time, but I'll say that the presence of the program is felt 40 hours a week. We have a unit set up in the corner of the clinic lobby, and there are books set out, and the library now is committed to having a full range of books that children can use and take with them home.
Wow.
We have also lots of good supplies now in games and puzzles, things that are interactive for the children to use. So we have an opportunity to see children anywhere from, I would say, 10 minutes to some stay for almost a 2-hour period.
What kind of age are we talking about?
Well, it varies by the year. In the summer, I would say it's most challenging because we have a large span. We've had children as young as 15 months to 15 years old come in. So we have to we pair up with somebody and try. Somebody works with the older and some works with the younger.
So there's several volunteers then?
Yes, yes. In the school year, right now, we have a younger cohort. I would say 3, 4, 5-year-olds is about the time. But it's ideal because the parents are involved. To a certain extent, some will come and will need to focus entirely on paperwork. But our dream scenario is when the parents come and observe and participate. And we know, I have to say that we know that we are having an impact because we find that the parents will replicate some of the activities that we're doing when we're playing with shapes and colors and so forth. We have little approaches that we will do to encourage the children and also to explain. The ideal is when we have somebody who's really fluent in multiple languages, and right now I'm very lucky to have a partner, Carolina Zamora Jones, who speaks multiple languages, and I think that her ability to interact with the parents is just as important as our ability to sit quietly and work with the children, or more interactively with games. So we try to do tie-ins.
Yeah. And I would say that we not only give books to the children when they leave, they each walk away with one book, but we also give out materials to parents on everyday language skills to work on with their children at home. So we're hoping that with our program, Reading and Educating to Advance Lives, we really are doing some lasting effects.
So where is this happening now?
It's happening we are at 3 different DHHS sites, one in Germantown, one in Rockville, and one in Silver Spring.
And if folks want to enlist in this cause, where do you want to give us a phone number and a website?
Sure. Anyone can contact me directly, Leah Bradley, at 301-255-4234, or can email me at lbradley@accessjca.org, and we can get anyone up and running, trained.
They're welcome to come and observe
Yes.
if they want
Yes.
to see if it's the right fit for them.
You've also been involved with the Village Movement, Marcy, I know that. Do you see a connection between this program and the Village?
Well, that's originally how we met. The IDI served on the Interages Advisory Committee and came in through the Village and got excited about the idea of folks who are in the Village in Silver Spring looking at this as a service component. So I'm sort of the first one to do that, but I think we will have other opportunities. It's a wonderful opportunity to give back, and I think we'll see more of it among Village members.
But Interages has a whole bunch of other programs.
Yes, we
Do you want
do.
to say a word about, for our viewers, of what else is going on?
Sure,
They might be-
absolutely. So we have a number of school-based programs, opportunities for adults to go into schools either during the school day or after school and help children academically, socially, emotionally. And we can do that through tutoring programs, mentoring programs, math programs, just a variety of ways. All of our programs really focus on how connecting the generation is a benefit to everyone involved. And we know that the kids in the schools really gain from our volunteers being in the schools and supporting the students.
So actually we have this large population in the schools of people from other countries who were, or in the ESOL program, the English speakers of the language.
Yes.
And we have this growing demographic of older adults in the county,
Absolutely.
so it's kind of a match, isn't it?
It is. It's a natural match, and we can always use more volunteers that want to get into the schools and provide that extra support and care for the students. And so anyone who's interested at all can contact me, and we can find the best volunteer fit, whether it be through the REAL program or one of our school-based programs.
So one last, we just about 30 seconds left, but
Sure.
how do you see that benefiting you?
Oh, well, I have to tell you a very practical reason. I don't have grandchildren yet, and this is taking an enormous pressure off my daughters because they say, you're getting your fix of engagement, because I come home talking about one child and another child, and it's just very satisfying. Honestly, I get more than I give.
Thank you for doing what you're doing. And,
My pleasure.
Absolutely. Thank you.
and thanks for coming in, Leah.
Thank you, Austin.
When we come back, we'll close the show today with information about the Jewish Social Service Agency senior programs.
Hey, mister, down here. You illegally passed the stop school bus. I'm placing you in timeout, and this timeout means big fines, plus you really could have hurt somebody. That's why school buses are being equipped with video cameras to help kids like me stay safe, so respect the bus.
The pain will not control us. It will never break us, define us, or keep us still. Because arthritis can't beat us if we beat it first. In the fight against arthritis, you need a weapon. What's yours? Visit the Arthritis Foundation at fightarthritispain.org.
Welcome back to Seniors Today. As even the most active adults age, maintaining independence and dignity can become more difficult. Jewish Social Service Agency professionals and trained volunteers bring warmth and companionship and convenience into the daily lives of seniors. Hilea Seeger, Director of Senior Programs at JSSA and a member of the county's Commission on Aging, is with us today to tell us what the JSSA has to offer. Well, welcome to Seniors Today.
Thank you. I'm very happy to be here.
Well, it's been a long time since we've had JSSA on. Tell us a little bit about what does JSSA do?
JSSA does a lot of things, so I'll try to be concise on this. JSSA helps people from the age of 0 to 103.
Wow.
It's been around for 120 years, and so one of our proudest things is that we are able to help people all the way through the continuum of aging, including people who are older adults, whatever that definition is for people. And for older adults, just like all of our other ages, we have a variety of programs, which is why I'm very excited to be here today.
Well, I know one of them is transportation, which is
Absolutely.
so important to seniors.
Absolutely. As a member of the Commission on Aging, I'm very well aware that transportation is one of the most important things facing seniors. We've recognized that socialization and the ability to get out is really essential both for physical and mental health. And so we are really dedicated to offering transportation services to seniors in Montgomery County. Our escorted door-through-door transportation is called Brenner Transportation. We use paid drivers who are trained in working with people with both physical and cognitive limitations. We're able to go and sit with people while they wait for the doctor. We can take them to pick up pharmacy medications, and we do non-medical rides as well.
So so there's a cost involved, I presume?
There is a cost. We do work as best as we can with people with lower incomes. We have a flat hourly rate, but if someone cannot afford that rate, they're able to apply for a sliding scale, and we will provide a limited number of rides on that sliding scale because it really is our goal to help all seniors in Montgomery County be able to use transportation.
Well, the idea of escortage is so important because some folks do need extra help and has nobody to take them and wait and that kind of thing. So do you have a website that people can look at the programs on and a phone or a phone number?
Absolutely. For the transportation program, like all of our other programs, you can go to www.jessa.org, and all of our programs will be listed. There is a search option on the top right of the website, so you're able to put in what you're looking for, and there is a phone number that will be listed there as well for the best way to contact. We also try to minimize the barriers to applying for this program, so it's just a one-page application that you can do online.
I know another program you have is called Transitions, but I'm not exactly sure what that means.
Transitions is a really exciting program. JSSA has a lot of volunteer opportunities, but Transitions is one of our most unique opportunities. A lot of people in the community know about JSSA Hospice program, but very few know that we have a transitions program that is a free program available to people who may not be ready for hospice or may not be within that 6-month time frame but really need additional help. One of the really exciting things is that it's a free program for people, and because it's a volunteer-led program. Our volunteers are highly trained. They go through hours of training before they do this program, and they also work alongside a professional. So if someone needs that extra help, grocery shopping, friendly visitor, or a family needs respite, Transitions program is absolutely available for those people.
Wow.
Yep.
So you have volunteers that do
Yes.
this.
We have over 100 volunteers that are dedicated to doing
this
particular program, and it is one of our most successful and most rewarding programs. And again, it follows our goal of really being able to help all residents of Montgomery County.
Well, that's terrific because I think there's a tremendous need for that kind of support. And you said it's free because these are volunteers who are trained.
Trained volunteers who, again, work with a professional, so they're not just free-floating volunteers. The professional will come out and visit about once a month, but the volunteer will often come out at least once a week.
Oh, that's terrific.
Yeah.
Now, I know that you also have a counseling program. What does that entail?
So we have two different types of counseling at JSSA. We have the traditional mental health counseling. We have very experienced licensed clinicians who will do in-home counseling as well as in-office counseling for seniors. We have clinicians that specialize in issues that seniors are facing, even though they may be the same that people younger are facing. And that service is reimbursed by insurance. JSSA not only does have a sliding scale, but we're very proud that we accept all insurance. So for counseling, mental health counseling, that is an insurance reimbursement.
So Medicare covers
Medicare covers that, Medicaid covers that, and most private insurance will cover it as well.
So again, one would call
the general number, which I will have to, I don't actually, well, so we have two different numbers. It depends where you are, but our general number would be 301-816-2633. And people can call that number for that, yes.
But you also have social programs and...
Yes, so our other type of counseling is more of a consultation, and this would be for someone who's trying to decide what to do next. It may be the daughter of someone, it may be you looking for help for your spouse, and there's one of the wonderful things about Montgomery County is there are so many resources in this county for seniors, but it is really difficult sometimes to navigate all the different resources, right?
Yeah.
Even someone asked me and I'm like, well, I'm not 100% sure, and it's because things are always changing and because
there's a lot going on, and
there's a lot going on.
We hear often, well, I didn't know that even existed.
That's exactly it. And so we do have what we call elder care consultations, which are one-time consultations, which help you kind of take stock of where you are and where you're trying to get and help connect you to all of those different resources. They may be internal resources like our home care agency or hospice or social programs, or they may be external resources. We have a lot of partnerships with different nonprofits as well as with Montgomery County.
And that also would be reimbursed by...
So that is not reimbursed. That is not reimbursed. But like all of our other programs, we offer that on a sliding scale. So if you are unable to afford the flat rate, which you can tell the person when you call in, then we can go ahead and assess your income and see what we can do.
So there's a lot going on and a lot of resources at JCA, and I mean, I know you also operate the Meals on Wheels program, and you have a hospice program as well, which folks can, and that's also covered by insurance.
Hospice is completely covered by Medicare, and our kosher Meals on Wheels are available to anyone, even if you're not kosher, and it's donation based, so there's no requirement for payment.
So we have about a minute left. Let me ask you a question. You joined the Commission on Aging fairly recently. What led you to join the Commission on Aging?
I moved to Montgomery County about 2 years ago, and as soon as I got here, I heard about all these wonderful things that the Commission on Aging did. I had been in a different state and had thought about joining the Commission, but the Commission on Aging in Montgomery County has a great reputation for getting things done, and I really care about getting things done to help seniors. And on a professional level, I think it gives me the unique opportunity to share with people all of the programs that JCA does have, because we have so many programs, but it also gives me the opportunity to make sure that JCA's programs are in line with what the residents of Montgomery County are actually looking for. And so it's a really perfect opportunity for me, both ways.
Terrific. Well, thanks for coming in and talking about JCA and the Commission.
Yes, my pleasure. Thank you so much for having me.
Well, that's it for this month's Seniors Today. Don't forget that you can access a great deal of information about county services for seniors by going to the Montgomery County Senior website at montgomerycountymd.gov/seniors, or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching Seniors Today.
When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who take action are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
Visit aarp.org/caregiving for information on how to provide even better care for the person who wants to care of you.